Thank you and good evening. A decision made by the Texas government has created a gap, potentially leaving out uninsured, low-income families of the Rio Grande Valley from benefiting from the new health care law. Under the Affordable Care Act, or Obamacare, every person in the country should, in theory, be able to obtain some sort of health care coverage. Even those who fall below the poverty threshold would get care through Medicaid. But because a majority of state lawmakers decided to opt out of the Medicaid provision during their last legislative session, it may leave those most vulnerable without insurance.
Unfortunately, because of politics and various reasons, it did not happen, which was something that I know that we were rooting for from the beginning, which is pushing to expand it, because we knew that it was going to benefit so many families here in Hidalgo County and throughout the state.
The nonprofit Center for Public Policy Priorities, or CPPP, says unless a change is made by the January 1st deadline, a significant chunk of those currently without health insurance would be excluded from the marketplace.
I do have Cameron, Hidalgo, and Webb numbers in front of me. Around 95,000 uninsured would gain coverage under the Affordable Care Act if we did the whole 9 yards and included Medicaid. We think there are probably about 62,000 or so uninsured adults just in those three counties who will be left without a coverage option.
According to healthcare.gov, singles making less than $11,500 or families earning less than $23,500 are considered low income. Anyone in this category wouldn't be fined because they wouldn't have access to the marketplace. Local congressmen are hoping to convince their state colleagues to change their stance on the expansion of Medicaid.
What we're doing now in the interim is, of course, asking the Speaker of the House to study through an interim charge the effects of not expanding Medicaid, not having health insurance accessible and affordable.
Each case differs, but a good source of reliable information can be found at www.healthcare.gov or by calling 1-800-318-2596. Some organizations recommend contacting your representatives and ask about local clinics that may offer other forms of health care for low-income families. Oscar Margain reporting for Fox 2 News.